Welcome everyone. I'm Leo Riella, the Medical Director of the Kidney Transplant Program at the Mass General Hospital. We are going to talk through the kidney transplant process with a couple of fictional patients. First, we will talk about kidney failure treatment options. Meet Michael. He's a 60-year-old grandfather of 3 who developed chronic kidney disease a few years ago. He has now progressed all the way to stage 5 or end-stage kidney disease, which means his kidneys are failing. When your kidneys are failing, there are about 3 different treatment options that you may consider. Conservative treatment, dialysis, and kidney transplantation. It is important to review your options and plan with your primary kidney doctor, also known as a nephrologist, at least 1 year before your kidneys fail. For some patients who may have a limited life expectancy, they may consider the conservative treatment. Conservative treatment involves a combination of medications, exercise, and changing your diet. However, with the conservative approach, your kidney function will continue to decline and may ultimately lead to death. Dialysis is a treatment that removes waste and extra fluid from your body. There are 2 types of dialysis: hemodialysis and peritoneal dialysis. With hemodialysis, your blood is filtered outside your body, and this is usually done at a dialysis center 3 times a week for about 4 hours each session. Some patients are able to do home hemodialysis with a small dialysis machine. Your kidney doctor will work with you to choose the best option for you based on your preferences and medical condition. With peritoneal dialysis, the blood is filtered inside your belly using a soft tube called the catheter. This treatment can be done at home with an automatic machine, or you can do manual exchanges yourself during the day. An important note about dialysis is that it only provides about 10% of the normal kidney function. Therefore, dialysis cannot fully protect your body against the negative effects of kidney disease in the long term. Let's go back to Michael. Based on discussions with his kidney doctor, Michael had decided to start dialysis a few months ago as a substitute for his failing kidneys. He's now considering getting a kidney transplant. His doctor tells him that 1 in 3 patients with kidney failure who stay on dialysis may die within 3 years. That is compared to 1 in 20 patients who choose kidney transplant. In other words, Michael has a higher chance of living longer if he chooses to get a kidney transplant than to stay on dialysis. Based on this information, we will probably recommend that Michael get a transplant if he can. If he doesn't qualify for a transplant, then dialysis can still be a good option. Kidney transplant is an operation that places a healthy kidney from another person into your body. It is a treatment for kidney disease, not a cure. We call it a treatment because when you get this new kidney, you will have to take medications for the rest of your life to prevent your body from rejecting it. These medications are called immunosuppressants or anti-rejection medications. Despite all these medications, the success rate of kidney transplant is excellent. More than 95% of patients who get a transplant survive in the first year after the surgery. Like any transplant, there is a risk for surgical and medical complications with a kidney transplant. Many of the complications after transplant have to do with the anti-rejection medications. These medications weaken your immune system, which will lead to a higher risk of infections, heart disease, diabetes, and certain cancers after transplant. Why would someone choose a transplant over dialysis? Transplant can provide you with a longer and better quality of life compared to dialysis. Patients who receive a transplant have more freedom and energy, allowing them to return to their daily routine compared to dialysis. Lastly, with a transplanted kidney, you have less changes to your diet compared to while on dialysis. With some dietary changes, Michael may be able to enjoy some of the same foods he's enjoyed with his families over the years. At Mass General, we have a team of providers, including transplant dietitians, to help customize your care after transplant. Unfortunately, not everyone can receive a kidney transplant. Our transplant team can discuss your options and make an individualized treatment decision with you. Who can receive a kidney transplant? A good transplant candidate is usually someone who is healthy, able to have a major surgery, and that does not have any other life-threatening health problems such as severe heart disease or lung disease, does not have any active infections, cancers, or drug use. You also need to have a good support system at home. When you get a kidney transplant, the first year can be very bumpy, with many challenges requiring you to come to the clinic very often. Even hospitalization due to infection or rejection of a transplanted kidney is possible. You need to have the right support around you to help you get through this time after transplant. Our social work team will discuss this in further detail. We don't have any age limit in terms of deciding who is a transplant candidate. However, we know that older patients who are weak, unable to move around easily, or unable to walk tend to do much worse with transplant than dialysis. These patients may spend more time in the hospital, which has a greater impact on their quality of life than if they were on dialysis. Our transplant team will help you determine if you would be a good candidate for transplant. If you're a good candidate, you will work with your kidney doctor to check if you have any symptoms of kidney failure, such as fatigue, weakness, or swelling that does not improve with medications. Also, we will look at your blood tests, specifically your creatinine and what we call the glomerular filtration rate, also known as GFR, that tells you about your kidney function. It is very important that you stay in contact with your primary nephrologist. They will help monitor and decide with our team when is the best time to move forward with the next steps when your kidneys start failing. If you're a kidney transplant candidate, there are two options for you to get a transplant. You can be on the waiting list to get a deceased donor transplant, and these are kidneys donated from patients who have passed away and the families or the patients themselves have expressed interest in donating their organs. Unfortunately, these are not available immediately because there are not enough kidneys out there. You may have to be on the waiting list for 4 to 6 years for a deceased donor kidney. Wait time depends on your blood type and other matching characteristics. The best option is usually a living kidney transplant. It is the only type of transplant that we can plan for, and patients often do not need dialysis. A living donor kidney is usually from a family member or a friend who is interested in donating their kidney to you. Kidney from living donors have a lower risk of rejection and last longer than a deceased donor kidney. If you're interested in a living kidney transplant, we will talk to you more about the requirements and guide you on how to reach out to family and friends in your community. Thank you.